She'll be talking on colorectal cancer as well. Yes. Doctor?
All right. Thank you, Prof. Leong. Assalamualaikum, good afternoon. Okay, so people with family history faces double the risk of getting colorectal cancer compared to those without. And this is devastating, isn't it? Because you can't choose who your family is. But the good thing is colorectal cancer is a preventable and treatable disease if detected early through screening. So that's why our National Cancer Control Strategic Plan have outlined this in encouraging people with family history to go for screening to curb the rising incidence of colorectal cancer in Malaysia. However, there are gaps in terms of knowledge and evidence regarding how it's being implemented, especially in this high-risk group. So our study aimed to explore, to fill the gaps, and ask the doctors on their views on barriers and facilitators to colorectal cancer screening for people with family history. So we gathered insight among 31 doctors through focus group discussions and in-depth interviews across different age groups, disciplines, healthcare settings, and whether they have postgraduate qualifications or not. So these are the key findings. So number one is heavy workload among the doctors and limited resources, often preventing them from offering screening in patients with their in daily clinical practice. However, there are some doctors who are motivated to screen. This is when they are in the training program, or they are involved in screening program, or they receive regular reminders. Another thing is when patients initiate the discussions themselves. But to tell you the truth, it's rare. Because shockingly, many of them do not know that when they have family history, they are at risk and they need to be screened. So some doctors combat this by using EMR and screening checklist form to identify them and offer them to screen. And third barrier is fearful of colonoscopy, deter many of them to go for screening. But with good doctors' communication skills and available patients' resources, may alleviate the fears and encourage them to embrace colonoscopy as part of sort of like a life-saving procedure. And finally, poor referral and appointment system. So this actually demotivates patients, leading to dropouts. But some healthcare settings have tried to use WhatsApp and Google Forms, which streamline the appointment system, and apparently it can actually increase the uptake. So in conclusion, at-risk people with family history have low-risk awareness, number one. Number two, doctors face challenges of heavy workload. And number three, a convoluted referral system hindered pathway completion, as represented in these quotes from the participants. I'd like to read particularly the number two. So there's this group of individuals who are just undeserved at the moment, where we know that they are increased risk, but we are still not pushing as hard as we can as healthcare providers to engage with them to reduce their individual risk. So despite policy being in place, there's evidence of substantial benefits of screening, but a lot of work needs to be done, and this needs teamwork. With that, I thank you.
All right, thank you, Doctor. Question from the floor? Needs to be some interesting topics.
Yeah, it's different from the first four.
Yeah, I think it's interesting. So, yes, your question.
I have a question for people that are adopted. What should they go about when they don't know their family history at all or can't access it?
Okay, well, that's a tricky question, because I think by right, if they can do DNA tests, of course that'd be good, but it's difficult. I think they still need to find their roots and who their family is. But in general, in terms of thinking of pragmatic way on how, we can just assume that they are at average risk. So there's still things that can be done to screen them. So at 50, they can still go for screening. Yeah. And of course, detect them early if they have symptoms. So awareness, I think, is important in the public. Yeah.
Okay, thank you. Any further questions? I think this morning we have some interesting presentation about multi-cancer early detection. So using liquid biopsy, circulating tumor DNA. Doctor, what do you think of the value of this type of test when it comes to detecting colorectal cancer early using blood, right?
Oh, okay. Well, because I'm actually from primary care, so that's not my expertise. But in terms of trying to detect and screen early, I think the first thing is, of course, awareness. But having said that, well, people with family history are increased risk. but we have limited resources. So it will also be good if, there are tests out there which we can further stratify even those with family history who are at even more higher risk, so that we can actually target them first in view of our limited resources in our country. Yeah.
Right. Okay. So, any other question from the floor? All right, so we will take note for that. So the limited resources, I think to all the scientists, we need to work harder to make all this accessible and
definitely.
affordable.
Yeah,
Right?
all right, thank you.
Okay, thank you.